When I started my career, I opened a mood program at the University of Toronto, and I had declared I was particularly interested in bipolar and major depression. And I remember at the time, bipolar disorder was really pre-contemplative. It was like, why would you want to spend time there? It's not a very common illness. There's very few treatments. Why don't you work in this area or that area? And what's interesting is I spent much of my first, maybe 10 years of my career diagnosing people with bipolar disorder. I've been spending much of my last 5 to 10 years of my career undiagnosing them with bipolar disorder. In other words, we see so many people who come into the program who have been told they have bipolar when they don't. And we're seeing lots of people who have bipolar who've been given some other label. I've actually had a lot of concern about the politically valenced notion that bipolar disorder is overdiagnosed. Bipolar disorder is overdiagnosed and underdiagnosed. So how can you have both? How can they coexist? So I prefer the language, it's misdiagnosed. And it's misdiagnosed more times than not. And for those individuals who in fact receive the diagnosis, we keep hearing that they've had many, many episodes, functional impairment before someone has said, you know, bipolar seems to be the more appropriate, more comprehensive diagnosis for you. So I would in fact not buy into the notion that bipolar disorder is overdiagnosed. I think it does a disservice to people who have the illness who are still not receiving the diagnosis. I think in fact misdiagnosis for me is more politically agnostic and in fact captures, I think, the essence of our problem.